A risk for having stroke, diabetes, and then transient ischemic attacks. And folks often miss these TIAs, as we call them, and go on and ignore them, and then go on to actually have a stroke. Dr. Albakri, we should talk about TIAs, because a lot of people have them and they're so glad their symptoms go away. They never tell anybody.
TIA is the angina of the brain, what we call it. If somebody had a chest pain for a few seconds, they run to the emergency room, they call 911. If somebody had numbness or weakness or trouble with their vision or trouble talking, they need to call 911 and get to the emergency room right away, because the brain is at risk for having a permanent damage, meaning a permanent disability and sometimes death.
Now, what can we do to lower our risk of having a stroke?
Well, you mentioned multiple risk factors as high cholesterol, high blood pressure, diabetes. Talking about all of us, we need to know about risk factor. We need to know about living a healthy life, meaning moderate exercise, quit smoking, moderate alcohol drinking, and healthy habit in terms of diet, which is very important, as you covered today. And one of the risk factors that recently discovered, and actually it's known for some time, but recently found that associated with high risk for heart disease and stroke, which is homocystinemia. There is an amino acid called homocysteine, that's natural amino acid that in the system. For people who had high level of amino acid, this homocysteine amino acid, they have high level, they are at risk of having heart attack or a stroke, even if they don't have any other risk factor. And this can happen even in children who had certain enzyme deficiency that can make this amino acid elevated in the blood.
Well, can you go and get a test for homocysteine?
There's a blood test that's available. In fact, there's a National Institute of Health is sponsoring a study for a patient who had a stroke, a recent stroke, to assess their homocysteine level, and there's specific vitamins to prevent stroke for these kind of patients who had high homocysteine level.
Well, and that brings us to vitamins, because we've been talking about vitamins tonight, and I know everyone's ready to run out there and buy all the antioxidants you can find. Don't do that. It's not necessarily the right way to go. But what about preventing strokes with vitamins? Is there some benefit besides those specific people that fall in that subset that have the high homocysteine levels? What about the general population?
We believe in what's being tested. Healthy diet is the most important thing. There are certain vitamins such as folic acid, B12 and B6. These are vitamins that are associated with a high level of, if a patient has deficiency of these vitamins, they have high level of homocysteine. But again, there is specific homocysteine level that we need to check, and specific dosage of vitamin that's prescription, not going to the pharmacy or to the drugstore and buy vitamins. But multivitamins is recommended for everybody who's not having enough healthy diet, I should say.
Well, a lot of people are of the impression that you know, they're just going to have a stroke. You know, it runs in their family. You know, they're unhealthy. Maybe they're smokers. Why are you so pro brain wellness? I mean, is there a lot that we can do to control the likelihood of having a stroke?
Absolutely, it's in our hands. Stroke is the most preventable disease. In fact, as I said, moderate exercise, healthy lifestyle, assessing risk factor, discovering that you have high blood pressure. If you ask your doctor about your risk factor, some people, they're walking around with a silent killer, it's called high blood pressure, and they don't check themselves with their doctor. If you have diabetes, if you have family history of a stroke, these people, they need to be screened early on to address their risk factor and treated immediately or prior to having a stroke. And this is why it's important to recognize risk factor early on, but it's most important is to live a healthy life.
Well, what about, say, for example, diabetics? You know, they've got so many problems. There's so many things that can go wrong. It's a multi-systemic disease. But what is it specifically about the diabetes that puts them at risk for stroke?
Diabetes is associated with atherosclerotic disease. Patients, they develop hyperlipidemia or increased fat in their blood, and that can cause disease of the vessels. And as you know, stroke is a disease of the vessels, so they can have even silent stroke, which means mean that a blockage of small vessels in the brain without them knowing about it.
Right.
And as I say, this is very important. If they have monitored their blood sugar carefully, they are at lower risk of having a stroke.
Now, we've got a picture that we can pop up on the screen that shows the blood vessels outside of the brain and going into the brain. Now, Dr. Albakri, what exactly can go wrong in our blood vessels that could lead to a stroke?
If somebody has, these are the carotid arteries. There are two carotid arteries in the neck, which is the right side. And if somebody has a blockage in this vessel, they can have decreased blood flow to a certain area in the brain. This area will not get enough blood. And what happens that this area will be damaged. If the patient arrives to the emergency room immediately, there is a chance of dissolving the clot that's here and restoring the oxygen and the blood supply to the brain in the area that's not getting enough blood supply. In addition, there is a new procedure which is called angioplasty. The angioplasty is putting a balloon in the vessel and try to dilate the vessel, or surgical treatment will be the other treatment that's available for people to prevent them from having a stroke.
And here we show the actual procedure, the angioplasty. Yeah,
angioplasty is well known in cardiology. Patients with coronary artery disease, they can have angioplasty and dilate the vessel. We are now testing angioplasty for patients who had carotid stenosis. If somebody had carotid stenosis, they get a balloon dilation of the vessel without going into the surgery, and a stent, put a stent to prevent the vessel from occluding again.
That's amazing.
That's a new advantage that we have in the advances in technology that's available for neuroscience or for preventing of brain disease.
Now, what about the quality of life for people that have stroke? Do we have more to offer them today than 20 years ago?
Much more, I should say. As a stroke neurologist, I can tell you that most of my patients and their family, they come to me frustrated, depressed because of disability that they have. Their quality of life has never been the same. However, there is certain treatment that's available to prevent progression of a disease. There is rehabilitation if it's done early on that can prevent spasticity, can improve the patient mobility, improve patient function, and there are certain medication also can prevent patient depression after a stroke, which is very common after patient they have a stroke. As I said, the advances in treatment of stroke is significant at this time in terms of prevention of progression, prevention of a second stroke.
You know, a lot of patients have this little habit of taking an aspirin a day. You know, they just take an aspirin a day because they've been reading in the paper that aspirin is good for you and just take one. I've treated a few GI bleeders in the emergency room that were doing that too, but is there any value to that?
Aspirin is the drug that's available for prevention of a stroke.
But should you be talking with your doctor?
I think it's very important to talk to your doctor because there is a risk associated with using aspirin for people who don't need to be on aspirin.
Right, fair enough. Thank you, Dr. Albakri, for being here.
Thank you for inviting me.
I appreciate it. And we love having you here. We're going to have you back again. And I want to thank all of our guests for being here on the show tonight. I hope that your brain is just booming with information now. We'll be back in just a moment. You stay tuned.
Just when you thought it was safe to be in your own home comes Attack of the Household Pests.
You stay tuned.